design these experiences to simulate training in low-frequency, high-acuity events. These are situations that don't happen often, but when they do, the stakes are high and lives are on the line. As we begin Module 1, the resident is placed at the foot of the bed. Our emergency medicine technician provides a debrief and current patient status. Our user is presented with a lifelike patient in need of immediate medical treatment. Team members include our ER nurse, respiratory therapist, and pharmacist. Interactive elements include the IV cart, airway cart, and selectable medications from the code cart. Navigation and selection protocols allow the user to make real-time decisions for patient treatment. The resident can also interact with the patient through hotspots on the body that allow for haptic pulse check, capillary refill, breath, pupil, and cardiac checks. VR training experiences like these provide our residents with an immersive and engaging way to learn new skills and become more confident and better prepared doctors. We believe this is the future of medical skills training and will have a major impact in medical education.